Good morning. Good morning, everyone. Hope we're all doing well. Thank you for joining this webinar. It's a very important discussion. Thank you for joining. We do have a good list of good panelists joining us as well. My name is Fatima Kamara, and it is my honor to chair this webinar hosted by Courier, a leading organization driving meaningful conversations and thought leadership in health and social care. This session cannot be had at a much more pivotal time as this, with the government's recent announcement regarding reform and an independent commission. I think it's a really, the time is right, and it's really appropriate that we're all here. I must say, even though for a short bit of time, for 30 minutes, and apologies, my camera is off. I've had issues with my camera and kind of logging on. We're presented with both the opportunities and challenges that could define the future of the NHS and health and social care in the main for generations to come. Someone deeply immersed in health and social care, healthcare strategy and policy, I know how critical this conversation is. And today we aim to analyze these announcements and, more importantly, discuss how we can achieve effective and actionable delivery to make a real impact for patients, providers, and the broader community. Just a bit of housekeeping. The webinar, as I said, is last for 30 minutes and will be focused on insights and analysis rather than an open Q&A format. We encourage participants to engage actively within the chat box, where you can share your thoughts, your feedback, and reflections. While we may not be able to address some of the issues, questions from the chat box due to time constraint, the discussion will remain very highly active. So please ensure your microphone remains muted throughout to avoid disruptions, but also feel free to use the chat box as and when you can. I'm delighted to be joined by a panel of esteemed speakers today. Before we begin, I'd like to invite each of them to briefly introduce themselves and share their thoughts on the government's reform announcement. Our goal for this session is not to only dissect the government's plan, but also think critically about how these reforms can be realized in practice. What are the opportunities? What are the barriers? And how can we, as key stakeholders, ensure the delivery of a more equitable and efficient system? So I would like to ask Paula Sheriff to introduce yourself and say a bit about the topic we're talking about today, Paula.
Thank you very much, Fatima, and thank you for having me along as a speaker today. So for those of you who don't know me, I'm Paula Sheriff. I currently work in a population health capacity, but I am a former Member of Parliament for Dewsbury in West Yorkshire, and was also the former Shadow Minister for mental health and social care. So do you want me to go into immediately, Fatima, just to talk a few points about some of the announcements that have been made? Or do you want everyone to introduce themselves first?
I think introduce yourself, maybe give sort of a slight overview in terms of the announcement, where your thought process are, and then would ask Nick to do the same, and then go to the next
Sure.
set of it. Yeah, so I
Yeah,
think that's fine. Yeah.
absolutely. I suppose the first thing I want to say is that I share everybody's frustration about social care. It's an issue that has been kicked into the long grass by successive governments of all hues. And I do understand why people are equally frustrated at the fact that, these recommendations won't be, or the report won't be published until 2028. I personally am a little more understanding of the fact that it'll take sort of up to 3 years, although we know there will be a form of a report that will be issued next year in 2026. I think Louise Casey is an excellent choice in terms of leading that inquiry. And I'm really pleased that it's a cross-party approach. I think that was absolutely necessary. I think we all know that all roads lead back to social care in terms of the challenges that the NHS is currently facing. Sorry, yeah. I think it's absolutely imperative that the time the timeline that has been issued is adhered to and has government backing. Sorry, I could see you then. Your camera went on for a moment, Fatima. And also, with regard to the announcement that Wes Streeting and Keir Starmer made around the elective recovery again. I mean, it goes without saying, a really, really important issue. I am a little bit concerned that we're just focusing on elective recovery at the moment, and obviously looking at the headlines over the last few days about some of the challenges being experienced in hospitals up and down the country with people potentially waiting sort of 40 odd hours in A&E. So I think I'd like to see kind of a framework where we look more at sort of prevention. So looking at the current sort of flu outbreak, you know, we possibly need to do more around vaccination. We need to encourage people to wait well. So people who are waiting on waiting lists, so they're encouraged to do things that will support a full recovery. So I'd be really, really interested to see. I do support the early access to diagnostics. I think that's incredibly important, and I think it makes a lot of sense. And yeah, I'd be interested to see what the other panelists think of that as well. So they're my initial thoughts, but look forward to hearing from others.
Thank you ever so much, Paula. I think that gives it a bit of a rounded perspective in terms of the report. I would like to ask Nick. Nick, can you please introduce yourself and just kind of the top slides point in terms of your views as well, please?
Yeah, hello everybody, I'm Nick White. Over the last 9 years, I've done 4 different medical director jobs, 3 in the NHS, one being Chief Medical Officer of an Integrated Care Board, and 1 in the independent sector. Looking at the 2 big areas of discussion today, the social care review is very strategic and long-term, and allows us to think about what we could possibly deliver, whereas the elective reform plan is very operational, very target driven over the next year and a half course of the Parliament. So 2 very different approaches. I agree with what Paula just said about the hospital waits we've seen in the news over the last 24 hours, and how to balance the elective recovery when we've got 15 ambulances waiting outside the hospital I work. So I should add, I still work as a consultant surgeon in the NHS part-time. And balancing, and many trusts up and down the country today will be cancelling elective surgery, despite being set a series of targets we've underwritten by new money in the elective reform plan. So 2 very different approaches, both very important.
Thank you so much, Nick, and thank you for that analysis. Andrew, can you please introduce yourself and also give us sort of your thoughts about the report and where we're at with it?
Thanks, Fatima. Andrew Stephenson. I am an ex-MP, served until July, and from November until July, I was Minister for Secondary Care in the Department of Health. So was dealing with sort of last year's kind of winter pressures and challenges, and working very closely with Helen Whately, who at the time was the Social Care Minister. I mean, I think for me, kind of top line, I do think, I am concerned about this. Feels like the can's being kicked down the road again. I think this is frustrating for a lot in the sector, and all parties are to blame for this. David Cameron had a big plan for social care, was never implemented. Theresa May, of course, in her doomed manifesto, kind of brought forward a plan, was never implemented, and then Boris's plans were half implemented and then scrapped. So successive governments have failed to deliver on social care. And one of the things I think is the Labour Party currently has a massive electoral mandate, a huge parliamentary majority, and therefore now was surely the time to kind of grip the nettle. And actually, when the new ministerial team was appointed, I did say to a couple of them, literally, you will have our support to make some big reforms to put the NHS on the sustainable footing it needs to be. And one of the biggest kind of nettles that needs to be grasped, without doubt, is social care. So the big picture kind of frustrated. Drilling down into some of the details of what's been announced, there is some encouraging things in there in terms of streamlining follow-up appointments and reforming aspects of the system. There are some which I would question whether they're actually going to deliver what we want to see delivered. Obviously, I was overseeing the rollout of community diagnostic centres, 160 new community diagnostic centres delivering 7 million tests. There's talk now about ensuring all of them operate 7 days a week, 12 hours a day. That was already in the pipeline. That was already going to be implemented. I think the bigger challenge on things like CDCs is, are all these tests actually being used the most effective way to get the highest number of people through in a clinically sound way? What we've been seeing recently in the stats is actually a lot of the same patients going for just more tests because there's more capacity in the system and no real scrutiny as to whether that's clinically sound or not. So how are we going to ensure this extra 500,000 tests, which Sir Keir Starmer has now announced is not just going to be kind of used up by the system and is actually going to help get waiting lists down? So very keen to get involved in the discussion and answer anyone's questions.
Thank you. Thank you very much, Andrew. Thank you for that. I think, as we can see, we've got a variety of panelists with quite extensive experience in this. And I think also having sort of the lived experience, but also having sort of decision makers in the room is quite pivotal in terms of what we're talking about. Myself being a nurse, working for NHS England, I think having worked in the sector for over 20 years, you could see all the different changes and everything that's happened in between. And what does that feel like and what does that mean, especially as we've mentioned with the Labour Party, and how will that be possible in terms of delivering it in the timescale that that's been given, health and social care? I want to add to that, based on everything that all of the panelists have just mentioned. There's no sorting out of health without social care. I think that's one thing that we need to really just hone in on. So when people talk about the NHS as if the NHS is just an isolated organization or institution, that's not the case at all, because actually whatever happens in health, in the National Health Service, actually affects social care. So the two need to be more joined up. There needs to be a more joined up approach in terms of commissioning, in terms of reforms, in terms of everything else that that it's been proposed to be achieved. So I would also want to find out maybe from my colleagues. So maybe Paula, if you can maybe just add to this in terms of what stands out most in the government's plan for health and social care reform to you, as you say it, in terms of what the Labour Party has proposed. And remembering that obviously we have an aging population, people are living much more longer now. The purse strings, as I always say, is never infinite. We don't have huge amount of money, because if we did, we would not be in this situation, because I think a lot of things will be sorted out quite quickly. And as Andrew has mentioned as well, and I think Nick to an extent, it's been an ongoing issue in terms of funding, in terms of structure, in terms of I remember from SHA days to PCT to ICB and everything, CCGs and everything like that, and all the acronyms that comes with it. So I think it's just where what stands out for you, Paula, in terms of the plan that's been announced.
Yeah, thanks, Fatima. So I agree in terms of what you said, and I think we can all quote examples recently whereby we know people, we have family members who are stuck in hospital and really don't need that medical care. They're essentially, I hate the phrase bed blocking, but they're in a hospital bed and they don't actually need it because they're waiting to be either transferred into social care. So I think there's some really good stuff around the work that's going on to support people in their homes. So whether that be kind of through telemedicine or providing medical devices, which enables people to be able to stay at home where possible. Although I think I would caveat that with that one again. I think we're all familiar with stories where people perhaps should be in hospital and have been sent home sort of prematurely. I think it's really, really important that we fully engage the workforce and people obviously listen to people with lived experience as well of the various sort of aspects of social care. I think with regard to the elective recovery, I'm quite excited by this philosophy about sort of that a GP can refer for the diagnostic tests. And I accept what Andrew says, that this was something that was coming down the line anyway, irrespective of the change of government. And again, I've got lived experience. I'm a cancer patient, and having to have a huge amount of tests and scans, when the reality was a lot of time could have been saved by just going straight to those scans, which was always obvious. That was what was needed. So I think, you know, in terms of optimizing the clinician's time, you know, that's quite an exciting way forward. So yeah, I think that's all from me for now. Thank you.
Thank you very much, Paula. Nick, I would want to ask you, obviously, you know, based on your experience and what you mentioned earlier in your introduction, what opportunities do you think this reform actually presents for improving patient care? And also the big thing that we're not really maybe focused on at the moment is workforce stability as well. What does that look like in terms of the reforms and improving patient care and workforce stability for you?
So there's two bits true. The first is what reforms will look like. It's a healthcare system, so every bit's connected to another bit. So because of that, there's problems when you get the interaction between social care and healthcare, but also in the healthcare itself. I mean, the DHSC's #1 priority is reducing waiting lists. That in itself is a reasonable thing to do, because even if you're looking at it from a hospital point of view, 30% of all GP appointments on the same day are people who are wanting a GP about a condition or on an NHS waiting list for. And similarly, 30% of all attendances in emergency departments from patients who are either using it because they can't see a GP or on an NHS waiting list for a condition, that condition's deteriorated. So if you're going to invest or prioritise anywhere, prioritising reducing the waiting lists does, if like start to unblock the system. So that's really reasonable. With regard to the workforce, one of the criticisms of what's come out for electoral reform plan is who's actually going to do the work. It's not true reform if you move activity just from one place to another. There's got to be either more capacity to do the activity or genuine different ways of working. Example, this is the advice and guidance, which is a really good system when it works. But if you're paying GPs £20 each for new referral, every time it goes into hospital, someone in the hospital's got to have a look at it. So it may well be taking clinicians away from frontline activity, seeing patients, to sitting in front of a computer screen like a role now and just replying. On balance, it probably will work, but it will mean changing job plans, and it's whether it's going to be genuinely more productive, people don't know. And with workforce sustainability, when I was a CMO of ICB, really struggled to staff our CDC, and because of that, it did open late. And now moving to opening 12 hours a day, 7 days a week, somebody's got to ask where the staff's going to come from. It may be by reorganising where people work, it's more productive. In a day at a CDC, you might be able to do 100 investigations, where in a acute hospital setting, the same staff might only be able to do 80. So it could well, offer an advantage, but it's got to be thought through, and it's going to have advantages and disadvantages, each of these changes.
Hey, thank you very much for that. Andrew, I would want to have your take in terms of what do you see as the main challenges in achieving this? And I'm one for not only talking about the issues or the problems, so however you want to define it, it's actually what are the solutions? What solutions do you think, in terms of the achieving this? And also I would want to also add, the commission of the report by the Casey report, the length of time it would take. What are the issues and what we're hoping to achieve, and what can we do in the interim in terms of getting this right, because we need to get it right. What would be your example? What would be your take on this?
So the big challenge for anyone sat in the Department of Health is always both ministers and civil servants end up spending a disproportionate amount of their time dealing with the day-to-day challenges, the critical incidents, the big problems, the current winter pressures, COVID and flu, and those kind of issues consume a huge amount of civil servants and ministerial bandwidth. Therefore, the amount of time for strategic thinking on these long-term things, how do we ensure that things like AI properly revolutionizes healthcare and delivers not just the kind of snazzy, kind of sexy things people want to talk about, but ensures that things like discharge notices and basic things are done in a very streamlined fashion, which frees up clinicians' time. How do we get those basics right, but how do we actually embed those processes in the system? How do we deliver the transformative change that the system needs? So there's a lot of problems. It's why, in terms of, as I say, the big picture changes, unfortunately, whilst I completely agree with Paul, Baroness Casey is an outstanding person put in charge, great pick. But again, we kind of all know what the big choices are, what the big options are. There's been a lot of thought into this. There's been a lot of independent investigations into this. It's about the kind of political will to implement it. So for me, I am concerned. I hope that I am proved wrong. I hope that the early findings give us a very clear steer of where we're going, and therefore the sector and people can prepare. And therefore, I very much hope I'm proved wrong, because I really do want the government to grapple this issue. Everything is connected. And one of the problems we are having at the moment, clearly in all the hospitals that have declared critical incidents, is that flow into social care is not working. The hospice sector has real problems. Nursing homes have real problems. There has been historic underfunding, which unfortunately growing pressures and national insurance changes and various other things have exacerbated. So there's a range of things here. I think we need to keep on harnessing the thoughts of people like Nick and others about how we can transform and streamline the system. I do think a lot of good things, there are good things in the announcement, and particularly, AI was referenced, and how we can harness technology. And ultimately, that's going to have to be used and embraced more effectively and more quickly in the NHS to transform services.
Andrew, can I just ask you, sorry to put in there, but can I just ask you, do you think we have mechanisms that are effective and efficient enough in sharing good practice up and down the country? I'm not suggesting that's a panacea, because I think the issue is far, far broader than that. But if we had a better system of saying, look, this works, we've done a pilot in Hertfordshire or in wherever, Manchester, and this, we found, statistically, that this has increased sort of discharges and is the mechanism there for sharing that?
So I think there are mechanisms, and some of them work. I do think there's room for improvement. I think the Getting It Right First Time program, for example, is one I would, we would all highlight as being a really good thing that has led to, changes in pathways, changes in practice, which is really good. It needs to happen more. We need to look at how different things happen. We need to, look at the independent sector. Obviously, that was referenced in this as to where that can work. I had a big deep dive with a lot of officials on things like dermatology. Obviously, teledermatology within the NHS is making big improvements, but where things are very simple, particularly in city populations, say in somewhere like Greater Manchester, where the waiting lists are particularly long, and yet you have an active independent sector there that is ready to take the simpler cases out of the system. There is surely an argument to say we need to work in partnership with the independent sector rather than in competition. And how can we harness that, and what does that look like, and how do we incentivize the system to do that?
So ideologically, like, working with the independent sector kind of puts a bit of a shiver up my spine, if I'm honest. But I think it's about how we frame that, isn't it? And like you've just alluded to, it's about working in partnership and not being particularly fussy about where the capacity is for the good of patients.
And ensuring some of those concerns about the private sector are addressed. For example, there's been concerns about staff training and the pipeline of staff. If things go to the private sector, are there enough kind of certain types of procedures happening in NHS hospitals to allow effective staff training? What is the staff training being delivered by the independent sector? So the independent sector by no means is a panacea. We've got to get it right. But that's, again, that's what was interesting in the announcement, and positive in the announcement, of looking at where there can be those partnerships in certain things to improve pathways, to reduce waiting lists, which, as Nick said, actually reduces some of the pressure on GPs, reduces some of the pressure on social care, because people have been waiting so long since COVID. We are now having a significant proportion of people rocking up at A&E or the GP surgery who, of course, is actually related to an ongoing medical condition, which could be fixed if they were treated in a timely manner.
I've got to go in a second. I do apologise. I've got another meeting at 1. Sorry for, I'm not trying to take over, Fatima, but I was just going to say that I've had an appointment this morning for a scan, actually in the independent sector, and it was 25 miles away, which was slightly irksome, particularly in this weather, but the service I received was absolutely superb. I'm not suggesting, I mean, I waited 2 weeks. I'm not suggesting that's down to a Labour government, but yeah, perhaps the independent sector can be part of the solution. And the only other thing I wanted to say before I go today was that we definitely need more money to look at things like public health, prevention, and health inequalities, because they're also part of the pie in terms of how we ensure that the NHS is sustainable for the next 70 odd years and beyond.
I think in terms of the independent sector, it's very interesting. I think, Paula, you've given an example where, obviously things happen very quickly. You're seen, and we used to have that with the NHS years ago. But now I think also when you look at the independent sector, there's always, when people talk about the independent sector as well, we need to, if we're saying we're trying to save money, obviously they come at a cost. How much are we paying to the independent sector? And we have to be more transparent, because when people do hear about the independent sector, the first thing they do think about is, why can't we do it ourselves? Do you know what I mean? So they don't look at all the other things that we've discussed about, but it's the issue about, okay, we want to make sure to bring down the waiting list. We want to do this. We want to achieve that. What part is the independent sector paying, if we're paying them that much? Or is that sort of a collaborative arrangement within the independent sector to say, listen, this is where we're at. These are the issues we have. We're struggling with this. Can you help? And what does that cost look like? Because for anyone, once you say private, we call it the independent sector, there's a big red flag that shows up. Why are we paying this to the independent sector? And they're profit-making organizations, most of them are. So we just need to kind of be mindful and address that as well. So we've come to the end. We've only got 2 minutes, you'll be pleased to know. I'm literally going to, I know there's been quite a few conversations in the chat that can still continue. And if you think, we've got people there to answer. If you think your question hasn't been addressed or you want to take it further, please feel free to email Curia your questions, and I'm sure someone will be able to, or maybe one of us will be able to reply to your question, or take your feedback on board, certainly. But I would want to summarize in terms of what we've discussed about today during this sort of chat. We're talking about the reform, the recently announced reform. I think what we've had here from the panelists, is we need to prioritize the waiting list, more streamlined systems in place, look at, I think from a holistic whole system perspective, look at what sort of the systems that we currently have, because I think we're, within health and social care, it's known in terms of duplication of tasks and different things. So maybe just kind of look at that from the broad perspective in terms of streamlining most of those systems, having the capacity to achieve the reform, whether some, what's been coming out is we're not sure whether this will be able to, the Labour Party will be able to achieve this in the time scale that it's set out to do. The big problems that we do have, obviously, with the winter problems, and also I believe also that there's no health without social care. So we really need to across the board look at that, and what does that mean in terms of more collaborative work with both. The other thing was AI and sort of revolutionize healthcare system. We have to also think about AI that, with in terms of GDPR and training staff to be able to use those systems as well. Within AI can also be, takes time to do, streamline, and in terms of freeing clinicians' time, and also just looking at, the current struggle and challenges within staffing, and the staffing, maybe with regards to our workforce, maybe reorganizing staff appropriately within various sector, and even also their job roles and things like that. We've also mentioned about secondary care and the issues being faced that, and maybe also it may be about streamlining and looking forward to Lord Casey's report and see what that brings in terms of deliverable within health and social care. So I want to thank all the panelists for all your contributions, and everyone that's attended today. Thank you ever so much. I think it's a conversation certainly that would continue, and I'm sure we would be able to host another discussion in terms of our views, maybe a few weeks down the line, few months down the line, even to see how this is all rolling out and panning out. But thank you so much for joining us, and thank you for your time. Do have a good day, what's left of it. Thank you very much, and thank you to our wonderful panelists as well. Thank you.